Ready?
Yeah. We now invite Dr. Navin Sakhuja. He will be speaking on digital workflow for diagnosis and management of retinal disease.
Thank you very much, everybody. So I'm going to start a little bit to do this 7-minute race to try and finish whatever I can tell you about this digital workflow in retinal disease. Now, we all know that basically there are multiple tools available to all of us, and every one of us is already using them, where we use multiple methods of different technology to either diagnose, prognosticate, manage, or monitor disease. I'm not going to go through the modalities. All of us already know them. But I'll tell you basically I'm going to talk to you about the way we run it. We run a small but busy clinic within Delhi. And we first and foremost register the patient. All our registration is linked to Forum. Forum is a software provided by Zeiss and allows us that once the registration is done, we don't, each technician does not have to re-enter the data again and again and again into different machines, which is upsetting for both the patient as well as for the technician. It takes up more and more time. Subsequent to that, the patient is immediately shifted to a refraction. If the patient is not improvable to 6x6, the consultant is called in and we start the dilation process right there so that the patient doesn't have to be have to wait to be started. Subsequent to that, the patient reaches the consultant where all the data is already on the computer, and all the history, the examination, the plus 90D, the IOP, everything is measured by the consultant on a one-to-one basis with the patient, so that we are able to. A lot of information gets revealed when you talk to them. You know, in the course of conversation, they'll tell you how they originally had a breast cancer. And subsequent to that, of course, all the equipment is available to us to go ahead and do what we have to do. So we use the Octa 6000. It's a safe method. It's quick. It's great for follow-up. I don't have to inject the patient with dye each time. Coupled with the B scan, it shows all the methods of managing the patient. It allows clear visualization and allows us to see the choroidal lesion that has been beautifully exemplified in the previous by the previous speaker. So I'm just going to talk to you about individual slides. This is a patient. On the left is a patient with a branch retinal vein occlusion. You can see large areas of CNP on the left, and on the right is a patient with he's a one-eyed patient with proliferative diabetic retinopathy. Both of these patients were allergic to fluorescent dyes, so the method that we have used over here is we have relied on the OCTA to diagnose, prognosticate, and manage these patients. Here's a patient who's showing you where there's neovascularization visible, as has been shown beautifully in the last talk, so I won't go through in great detail about this. The other method we use for monitoring and looking after patients is the Claris 700, and I can say this without doubt that this is one of the finest machines that I have ever used for photography. It's just absolutely fabulous. With a small pupil, we get absolutely crystal clear views, and we get true color manifestation. We can also do an autofluorescence with it. Here is a guttering seen in a pachychoroid. Here's a stippled change that you see on pachychoroid again. Here, this is a patient who was originally diagnosed as being as a patient of papilledema. She had been to 2 other doctors. It was basically blurred disc, and they had been carrying on with that, and the OCT showed no cupping and as well as elevation. But a simple thing like the FAF showed up, the thing is an optic nerve head drusen. Here's a FAF and AMD, both blue and green. With that, we come to fluorescent angiography. We use a wide field fluorescent angiography. Primarily for diagnosis, it's not really something that we use on regularly for follow-up because you have to inject the patient again and again. But in certain situations, you need to, and I'm going to come to those just now. This is just to show you an image of what the Claris shows as a true color image. Here's a patient of severe, really bad case of CRVO. Here's a patient of Coates disease, where you can see the little circle in the center shows you what conventional fundus imaging shows. Here's a patient of vasculitis, and here we had to use fluorescent angiography to monitor her again and again because we wanted to see the image, to see whether she improved. And she did not improve with oral steroids. She finally improved only with Ozurdex. Here's another patient who just reported to us recently with hypertensive retinopathy. And frankly speaking, when we saw her originally, we were wondering what it is, but we checked her BP, had a look at her, and she showed a typical picture of hypertensive retinopathy. Here's diabetic retinopathy. Now, this patient came to us from out of town, and if you really look carefully, you can make out that there are changes, but otherwise it's a fairly bland-looking retina. And here's the angiogram. And this patient was another patient where, for the workflow, we had to follow up the patient again and again with angiography. This is the angiogram after the anti-VEGF injection, and we've started the PRP, as you can see. Here's another diabetic retinopathy, and here's a patient with macular dystrophy. I just overheard someone talking. She's going to be talking to us in great detail about macular dystrophy subsequently. This is another patient with pachychoroid. Pachychoroid again. Now here we've used multiple methods to monitor, to look at this patient. And we have you can measure and see that in the subfoveal area, you've got a thickening of greater than 300 microns. Here's a patient of a BRVO, where the method of monitoring for the workflow, here we've used just the OCT and the angiography, and you can see the amount of fluid that is accumulated there. This is a patient with an old patient of BRVO. I mean, she's had BRVO for a long time. We've given her multiple injections, and the follow-up is usually being done for her by OCT alone, which is showing an improvement in the subsequent, in the slide on the right. This is a patient who came to about to finish.
No, one more minute.
Yeah, just two more slides. This is a patient who's shown an improvement. The green ones show you after we've injected her with Pagenex, and the initial injections were all with Eylea. This is one of the things we use regularly to examine patients in the retina workplace, where we are able to superimpose images of the OCT on the fundus image and able to monitor them to see what we need to see to sort of register it on that thing and see what we are trying to look at on the fundus image. I'm not sure this is showing up or not. Yeah, there it is. You see what it looks like on the video. This is another patient. You can see the 2-3 serial studies are registered, and so you can see that the improvement takes place over here on the after the injections. So finally, I want to say, one thing that I want sort of as a takeaway is that one must be very mindful of over-investigating. All of us have lots and lots of equipment and lots of methods of investigating these patients. There's a financial implication both on the side of the doctor as well as on the side of the patient. So as far as possible, try and tailor-make the investigation to the patient's disease. Thank you very much.
Any questions from the audience? No, I think anybody would like to make this workplace, is it a software that is into which system? Into your EMR?
See, the EMR, I use an EMR from Bangalore called EHNote, and the EMR is linked to Retinal to the software provided by Zeiss called Forum. Forum is a sort of server in which all the machines are linked. That means Claris is linked to it, and the OCTA is linked to it, the field analyzer is linked to it, including the phoropter is linked to it. Now, every time I want to retrieve data, I can retrieve directly from Forum. Retina Workplace, they have a Retina Workplace and a Glaucoma Workplace. I don't use Glaucoma Workplace. Retina Workplace allows me to, the moment you put the image of the OCT, let's say of the OCTA, onto the color image, it registers on the color image. So that means all subsequent images you are seeing exactly the same area, and you're able to follow them up like that, like the way I showed in the last video.
Okay. So that simultaneously it plays the first time?
Yes. Okay.
So I think, thank you very much for bringing up this thing.